Since 2008, I have been fighting for healthcare reform with the Virginia Organizing Healthcare Reform Committee. It's not been an easy fight, but we now have a comprehensive law, the Patient Protection and Affordable Care Act, that when fully implemented will provide affordable, accessible health coverage for all Virginians and all Americans. I'm here today because it is a law worth protecting. This law is a lifeline for Virginians, starting with 1 million uninsured, many of whom are just one serious illness away from having to choose between bankruptcy and medical treatment, and many of whom would needlessly suffer or die for lack of coverage. This law provides long overdue basic consumer protections for all Virginians against denial and cancellation of coverage when we need it most. Last month, 6 provisions of the law kicked in, including consumer protections that end some of the worst insurance company practices. It's already making a critical difference in the lives of real people in our communities. And if you have any doubts about that, you should ask the parents of children with pre-existing conditions who can no longer be denied coverage, or young adults without insurance who can now get coverage over their parents' policies. Or ask someone with a pre-existing condition who can now get coverage in a high-risk pool, or someone who's been afraid to seek treatment whose insurance can no longer be canceled when they become ill. Try asking someone facing potentially long and costly treatment who no longer has to face lifetime limits on benefits. This could be any of us. Now, 25,000 young Virginians will be able to stay on their parents' health insurance until they are 26 years old. The law ensures that preventative coverage, like mammograms and colonoscopies, are covered by insurance. Thousands of Virginia small businesses have already received tax credits to offer coverage to their employees, and almost 110,000 are eligible. Once the law is fully implemented, insurance companies will not be able to deny any of us coverage because we have an illness or drop us when we do. It's regrettable that we have to stand here today addressing the Attorney General's attempts to block health reform, particularly at a time when Virginia is facing tough choices about budget cuts. It's difficult to understand why the Attorney General and the McDonnell administration are investing taxpayer dollars in a frivolous lawsuit. Just last week, a Michigan federal court judge rejected a challenge to the coverage requirement, ruling that the law was within Congress's constitutional right to regulate interstate commerce. We would like to see the Attorney General, the state's Consumer Counsel, pursue cases that actually benefit consumers, rather than a lawsuit that, if successful, would ultimately cost us urgently, critically needed, life-saving protections. Despite the ongoing court battle, Governor Bob McDonnell has been working on implementation of the new law in Virginia, and many groups like Virginia Organizing and individuals are participating in the process. Governor McDonnell does clearly understand that the Patient Protection and Affordable Care Act is now the law of the land. 2 weeks ago, the governor was actually celebrating the $2 million in increased health care funding for older adults and those with disabilities that was due entirely to the new health care law. Yet, ironically, he and the Attorney General continue to pursue a lawsuit that could repeal reform and return us to a status quo where insurers deny coverage for pre-existing conditions and cancel coverage when you become ill. We are here today as a reminder that without health care, 1 million Virginians will be left out in the cold, without insurance, playing the odds with medical and financial catastrophe. Eventually, the insured foot the bill anyway. The average American family with insurance pays over $1,000 a year now in higher premiums to cover the cost of care for the uninsured. In Virginia, between 2000 and 2009, our premiums actually increased 90%. Let's stop using scarce public resources to pursue a lawsuit that is contrary to the best interests of Virginia taxpayers and consumers, and focus instead on making sure all Virginians have the protection of affordable health insurance. Let us remember that real people's lives are at stake here. Thank you.